most important areas to focus on. There are three. Number one is her temple, because we want to fill this area in. Number two is the cheeks, lateral cheeks right here. Number three is the jawline, and you're gonna see me inject those three areas. Hi, this is Dr. Behnam. I'm a board certified dermatologist. Today we're joined with one of our lovely patients today. We are going to be doing Sculptra injection. This is her second Sculptra injection that we're going to do. You're welcome. First of all, how did you think we did after we did the first Sculptra injection a couple weeks ago?
First, it looks really amazing, and then it goes down, and now it's coming back. It's stimulating something in my system, the collagen or something is starting to come back. And people notice it. They go, "Oh, you look really good," and I'm not wearing any makeup, and I'm like, "Awesome!" You know, this is really kicking. I love it.
How did the hollowness in your temples and cheeks make you feel? Why did you come to me?
What's always bothered me ever since I was a child was I had very, very hollow cheeks. I looked like a skeleton even when I was 12. So I've always wanted that filled in.
So for example, so I'm just going to demonstrate. So in her, what it is the temples, it's hollowing out that really, makes you look older. And also the lateral side, the lateral cheeks, look how hollow she is. So by injecting the temples and by injecting here with Sculptra, it stimulates your own natural collagen, and as it fills in, it's lifting, and this is why we call it a liquid facelift. What I also do, there's a trick, I also inject along the jawline here and also right here. So see what happens as it fills in, guys. You're pulling up. You have a much more well-defined jawline, a straighter jawline, and some people actually have a jawline after we do the injection. Now, you did bring something up very important, is that you didn't want the fake stuff to be put in your face because it looks fake. Sculptra is very natural because it stimulates your own natural collagen. So it is the best product I use. I do a lot of Sculptra in my office and I love it, So, okay, so we're gonna put the numbing on and we'll get started.
Awesome.
Great, here we go. So Sculptra comes in a powder in a vial like this, and we typically mix it up in our office about a week before. Here we go. Perfect. So I've already reconstituted this. We just add the lidocaine in today. We drew it out, and then we're gonna take the syringes, put the needles on them, and take it to the other room where we're gonna inject our patient of the day. So again, this is her second Sculptra, so she's been through this before. Again, most important areas to focus on. There are three. Number one is her temple, because we want to fill this area in. Number two is the cheeks, lateral cheeks right here. Number three is the jawline, and you're gonna see me inject those three areas. We're gonna get started. So 1, 2, 3. I look at the veins, make sure I'm not going right into the veins. You pull back on your syringe and you just inject. Perfect. So I inject a little bit, and again I'm gonna go a little up here. Remember, Sculptra stimulates your own natural collagen. So here we go. So I filled it in and we're gonna massage in a little bit. Afterwards, she's gonna get a nice massage afterwards. Okay guys, so you can see we filled it in. Here we go guys, now we're going to inject right here, and I'm going to fill in this area. See, you could literally see it fill in as we speak. Okay, she needs a little more up here, so I'm going to take my syringe and basically put it right along the jawline right there. Look at that. That's her zygoma. That's the bone right there. That looks pretty good. Also remember, you gotta do the jawline, guys. Gotta do the jawline right here. Very, very important. So now we're gonna do the left side.
Okay.
How was the pain level?
It's not bad at all. It really isn't. And you're very gentle, and the massaging is soothing.
Yeah. So I'm going to do the massage part right now. The best part about the Sculptra is the massage. So I'm just going to put some
And then you take it off.
Yeah, I'm gonna put some Vaseline.
You don't want me to come back with zits.
And basically we massage it. And I always tell my patients, do about 5 minutes, 5 times a day for about the next 5 days. That will help with the collagen stimulation, allow the Sculptra to go where it needs to go. Alright guys, thank you so much for watching. Please watch our other Sculptra videos. You guys will love it. Thank you.